I think when we look at doctor productivity, the first place it starts is with schedule. Scheduling is, if you don't schedule and maximize your schedule and schedule to be productive, you will adapt to your schedule. And I think a lot of doctors, what they do is they establish benchmarks. They establish benchmarks for their appointments. They determine that this is what it normally takes me to do this much dentistry, and they live by that. And unfortunately, what tends to happen is the mindset is that you adapt to this situation. Instead of actually adapting to a situation that says, I want to be maximally productive and efficient, and you'd say, why is that? It's because no patient has ever asked me to slow down. No patient wants you to have them in the chair longer. And even better, if you can actually be more productive in a shorter period of time, you can do more dentistry, which means less appointments for the patients. So I think the sensitive or the least sensitive way to look at this is get into a mindset here that what you're doing now, get into a paradigm shift. There could be a better way. And even if you make small steps toward this, what I want to do is I want to tell you, I'm not the most productive guy going. There's many dentists out there that are far more productive than I am. And what we hope to do in this is to share some of those very best practices that we have. Maximizing your schedule has to be a coordinated effort with the team as far as knowing exactly what needs to be booked, how it needs to be booked, how it filters into your schedule, and that has to happen not just from where it's booked in the hygiene rooms, is where most treatment occurs, right out to your front desk. So they really know clearly how the schedule is going to flow, not just each appointment, but how it links with all the other appointments during the day. And if we want to look at more now the micro view of your schedule, that has to be controlled totally, not just by the team, but by the doctor. The doctor has to be very aware down to the minute where he is in his schedule. And again, I'm going to reference this again and again. It's because you need to make the treatment in the chair, which is all about maximizing your productivity, it has to be done in such a way that it becomes seamless for the patient. Now to do this, you don't want to build extra time into your schedule, but you want to build enough time into the schedule. If you see what happens in a normal day in a normal busy office, we want you all to have very busy offices. What you need to do is you need to understand, how do I filter in with my hygiene checks? How do I actually integrate that into where I am with my chair side? You have to have enough operatories. You have to have a schedule that says there's times that you need to let anesthetic work. You have to work that in. You have to have probably at least 3 operatories for a doctor. Now, when you have 3 operatories, it's easy then to slot people in, to let anesthetics work, to put overflow treatment in, to put walk-in emergencies. You need to then allow that to actually flow into your schedule that you can then pull, or for sake of a better word, move somebody from a hygiene appointment that requires treatment on the spot into a separate room with a dedicated chairside assistant, and then that's how you're going to be able to perform that treatment on the spot.